Did you injure your Achilles tendon, or do you just want to learn more about the Achilles tendon? We're going to go over the Achilles tendon 101 in this video. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. In this video, we're just going to go over the basics and fundamental principles of the Achilles tendon and the injuries associated with the Achilles tendon. Let's jump into it. So the Achilles tendon is the strongest tendon in our body. So the Achilles tendon is composed of three muscles. Well, two main ones and ones not a lot of people talk about, but it's the gastroc muscle, the soleus muscle, and the plantaris muscle. Those three muscles insert into the Achilles tendon, which goes down to your heel. And that's where you have that tendon, that long strip of tendon there from your heel, and then it turns into those muscles. So those are the three muscles. And those muscles are the gastroc is the one that goes above your knee. So it goes from above your knee down to your Achilles tendon. Your soleus goes below your knee, and the plantaris goes across your knee down. So now that we know what muscles compose to the Achilles tendon, like I mentioned, the gastroc, soleus, plantaris, the main purpose of the Achilles tendon, or the main muscle action, is that plantar flexion. So pushing your foot down. So if we're standing, it's getting up in a calf raise, a heel raise. That's the main component of that Achilles tendon. It also accepts the load whenever you're running. It does that shock absorption, running, jumping. So whenever you do any movement in basketball, your Achilles tendon is going to be working. So let's go over the common injuries and some of the common causes. So the main couple ones are the tendon issues with the associated tendonitis, tendinopathy. So whenever we have a tendon, we're always at risk for any tendonitis, tendinopathy. So with the Achilles tendon, let's go into tendonitis. So tendonitis is when you have that quick flare-up, you have inflammation of the tendon. The most common cause is that acute spike load over, let's say, 2 or 3 days. So meaning, like, let's say you have a huge tournament. You're playing in like 3 games on Saturday, 4 games on Sunday. Then on Monday, you feel some tension in your Achilles tendon. Maybe like it feels off, it hurts to kind of walk. So that's more of a tendonitis issue. You had an acute workload. So like I said, usually that happens when you just go from, let's say, playing 1 or 2 games on the weekend to 5 or 6. You increase that load for that weekend, just an acute event, then you have the tendonitis issue. The other issue that's very common is a tendinopathy, and that's a chronic overwork. So it's what tendonitis is, but in a bigger scale. Tendonitis usually will get better when you rest it, get back into your activity, and just increase your strength. With tendinopathy, it takes a little longer because it's more of a chronic. We're talking about, let's say you were playing basketball twice a week, then you bumped it up to 4 times a week for the next 8 weeks, and then you also did a plyometric program. So a lot of this load, a lot of running, starts putting a lot of stress in the Achilles tendon, and if the Achilles tendon can't handle that stress over time, then you have the tendinopathy issue. And with these tendinopathy issues, they take longer for your rehab. We have a great video on Achilles tendinopathy rehab progressions. Click the description below. But we also have an Achilles tendon program that we'll jump more into it to discuss the Achilles tendinopathy. But the Achilles tendinopathy, rest will not help it because the tendinopathy is more of a chronic overuse injury as opposed to the tendonitis injury. The next one is followed from a tendinopathy issue, which is the Achilles tendon tear. A lot of the times people say, oh, I took a bad step. Now it's usually over time the Achilles tendon has these micro tears, then it leads to that failure collapse of the Achilles tendon tear. The Achilles tendon tear, the most common one is when your foot's behind your body and you're pushing off, and that has the maximal stress on the Achilles tendon, and that's where you have the Achilles tendon tear. But a lot of the times, a lot of the athletes that we work with, the main common thing is they felt some calf tightness, Achilles tightness, so it just didn't come out of nowhere. There's always some precipitating factor before the Achilles tendon tear from all the athletes we've worked with. But the Achilles tendon tear, that is when you actually need to have surgery, especially if you want to get back to sport. There is the conservative therapy where they cast you up and you don't move your leg, because whenever you tear your tendon, they want to sew it back in place. So it's actually best to, if you're going to have surgery, to have it right away. And if you're not going to have surgery, you want to avoid any significant stretching of the tendon because it won't heal. So whenever you have the surgery, then we're talking about 8 to 12 month recovery, but they're actually going to repair the tendon. So it's different from the ACL injury, where an ACL, because a lot of people ask us what's worse, an ACL versus Achilles tendon. Achilles tendon, they don't have to put a new thing in your body, they repair that tendon. ACL, they put a new ligament in your body. So the tendon tear, it just takes a while because your calf gets so weak. But those are the three main injuries when it comes to Achilles tendon. We have the tendonitis, tendinopathy, and Achilles tendon tear. And then another big thing is, what are some of the risk factors for Achilles tendon issues? So one that we see a lot of times with our athletes is, one, their calf strength, their ability to do heel raises is not as strong. So they don't do as many heel raises, so that puts you at risk for any Achilles tendon issues. Because I mentioned, every time you're pitching off in basketball, jumping, you're loading up that Achilles tendon. So if that calf muscle isn't strong enough, you might be at risk for Achilles tendon issues. Another one too is sometimes when we see with some athletes, I have one athlete that their right foot overpronates and their left foot doesn't. So it's not so much when both feet are flat, it's with one foot's more flat than the other. There's some kind of biomechanical issue there. That puts a little bit more strain on the Achilles tendon as well. So that's another risk factor, having overpronation, or also another one is not enough dorsiflexion. So if we don't have good mobility in our ankle, then we put a little bit more stress on the Achilles tendon because now we're not able to go through the full ankle range of motion. So those are some of the risk factors associated with increased risk of Achilles tendon injury. So let's just give you a recap of what we went over. So the Achilles tendon is the strongest tendon in your body. There's three muscles that attach to it, the gastrocsoleus plantaris. The main purpose is to push off on the ground, lift your heel off the ground, and it's really important for any basketball player to have good strong calves, good strong Achilles tendon, because that's going to allow you to do all the movements that you want to do on the court. The injuries associated with are the tendonitis, tendinopathy, and then we also have the tendon tear. So when it comes to this, make sure you're adding in your rehab for your Achilles tendon, especially as you get older, because you're more susceptible for those Achilles tendon injuries. And that's going to get us to the next point. We have a great Achilles tendon program. This is going to be able to get you from that Achilles tendinopathy issue back to hooping. We have a step-by-step progression. Click the link in our description below, but it's a great program for anyone dealing with any Achilles tendon issues, or if you want to just decrease your risk for any Achilles tendon. Hopefully you guys learned a lot from this video. If you guys have any more questions about Achilles tendon, tendinopathy, tendonitis, comment below. We'll try to answer as many questions as we can. And if you want to work with us online, send us a message on our website or in person in Los Angeles, California. We are the Basketball Doctors. Let's ball for life.